Hi everyone, and welcome to our next Community Spotlight video with Ethan Hicks. In this episode, we're going to be talking about Ethan's experiences with TMJ Dysfunction and the physical recovery process. Once again, I'm happy to introduce Ethan Hicks. So, for our next kind of topic, I wanted to talk about TMJ and that kind of physical recovery. And I'll be pretty honest, I'm not super familiar with the concept of TMJ and only kind of became aware of it like a few years ago. I'm probably going to butcher the pronunciation, but temporomandibular joint and that function. And I know you've talked to me about that and your experiences with it. If you could maybe just give like a quick definition of how that of the condition and then how it's kind of affected you as a clarinetist.
Yeah. I mean, that pronunciation was pretty spot on, so no worries on that. TMJ is funny because when people say that all the time, like, oh, you might get TMJ or you might have TMJ. Everyone has TMJ. It's the joint in the jaw, that is supposed to be aligned in the correct way. It helps move and keep certain muscles and other joints in place where they're supposed to be. When you have TMJ dysfunction, that's when it becomes unaligned in some fashion and causes extra stress on those muscles or other joints that are in that position. It can result in clicking of the jaw. It results in some dull pain, sometimes very sharp pain, but most of the time a pretty consistent dull pain. It can extend very easily through the neck and the arm if it goes like really severe, and it can definitely go up into like the back of the head where it can cause like tension headaches and that kind of thing as well. So there's a lot of different symptoms that go with it. People have just kind of resulted to calling it TMJ without remembering that it's that's the thing that we all have. So it's something that as wind players, especially with woodwind players or reed players even, we try to keep, a focus on that we don't get it because it can be pretty detrimental. My personal experiences with it, unfortunately, were set off by some unfortunate wisdom teeth problems that occurred. I had all four teeth impacting, which, if you don't know what that is, like you have all your teeth facing upwards, and then, if a tooth is impacted, it's growing into it. But mine was literally like perpendicular, all four just going into it and shoving. So the jaw was under a ton of stress for a long time. I think back in 2016, I was kind of aware that those teeth needed to get out, but they were like, you can wait, don't worry about it, don't rush yourself. In 2018, it got to so much pain in my mouth of trying to keep everything just like glued to the mouthpiece while also dealing with that, that I like was in tears doing performances and things, and it was really, really bad. So we knew we had to get them out. And it got to like the last rehearsal I did a dress rehearsal for an orchestra concert 2018, and I had numbing gel on every tooth or where it was growing in, and every couple minutes I would stop playing to reapply numbing gel to it. So like I did a 3-hour dress rehearsal just like in tears and numbing myself, and I was like, I should go get these out. So I got them out, and the procedure was fine. They tell you to wait like about a month or so to play, so there's no blowback or anything like that. It doesn't damage the gums. And I like slowly eased into it. I was very careful. It came to be though that with how long I waited to get them out and with how much tension I had trying to just hold on with the wrong muscles too, because I did have a lot of embouchure stuff to redo. It turned out that it had disaligned the jaw basically. Like very slightly, but enough that it caused like severe clicking daily, very, very dull pain throughout the entirety of the day. And it kind of progressed a little bit. So sometimes you can have it where symptoms will flare up during the day a little, but most of the time you're fine. Or like you'll start the day fine, and as the day progresses, it might get worse. I have a case where I wake up with it and can feel it automatically. Like it doesn't go back to normal ever. It just goes to like, this is manageable, dull pain that I can handle, And yeah, so this has made for quite a couple issues in terms of playing. It's made it really hard to play for long periods of time and do too many performances. And it's been mentally stressful, especially as someone who is trying to be a professional musician, to regularly have to reflect on, is this something I physically can do, or is my body saying like this isn't an option anymore? So it's a very rough thing to have for wind players, and I do not, or I completely empathize with anyone going through any jaw problem like that. So hopefully that sheds a little bit of light on kind of what I've started going through with it, and what it kind of means to me.
For sure. I think from the outside perspective, just to clarify, I think a lot of myself included and a lot of other people view TMJ as purely affecting wall playing type of thing as a player, and certainly that's the case. But so just to clarify, like what you're saying, that there's some symptoms and effects that can happen throughout the day when you're not even playing the instrument.
Yep.
Okay.
Yeah, it's a constant thing for me. It's like someone is like pressing into. For me, it's on both sides, but it's the most on my right side. This might be flipped on the camera. I can't tell. Um, it's like someone has been pressing right underneath where the center of the jaw is, and it's just like a little bit of or discomfort, and it's not going away. Like whoever that is not taking their hand off of where that spot is. It's a very small but dull and apparent thing. When I play, if I use the wrong muscles, it gets worse. If I use the right muscles, it kind of stagnates and stays where it is. So it's not getting too much worse when I perform, luckily. But the muscles and the joints and everything that I used to play before having these issues are not as strong as they were, back then as they are now. They're a whole lot weaker, and that makes, when the pain starts, I have to stop. Of course, anytime you get pain doing anything, you should stop playing. You have to stop, and you have to try to do some stretches and relax everything. You may just have to be done for the day when they flare up too bad. And for audition season specifically, that was a ton of issues for me. Like, could I play a half-hour audition tape, without falling off the mouthpiece and like just being in tears because of pain and stuff like that? It was pretty severe for a while. So there were a lot of audition takes that just got scrapped because I just physically couldn't make it through. But it is something that sticks with you pretty much all day, depending on how rough the flare-ups are. Mine is just kind of like it goes through the back of the head a lot, so I'll feel a lot of tension, headaches back there, and my neck itself is a lot tighter due to a lot of what's been going on with the joints up there. It's really weird. It's kind of stupidly complicated, I think, and I'm not a medical professional, so I won't try to dive into it too much, but it does create a fair bit of stress throughout the day as well, outside of just playing, unfortunately.
Absolutely. And I know that, I mean, just talking with you over the years, you've really worked on this and gone through a lot of physical therapy and like progressed a lot from where you were when you got your wisdom teeth out. And I know you talked about a little bit or alluded to that kind of the embouchure reforming at Oklahoma. And I was just wondering if you could talk a bit about just that process and what you did there. I know there were a few times you like sent me photos of these like embouchure like type contraptions to like work on and like without inherently playing the clarinet.
Yeah. Yeah, there were a lot of exercises. I think that first month I was down there at Oklahoma, I didn't really touch a clarinet, to be fair. I think I did some finger exercises, but I wasn't really supposed to play anything. Just to like quit cold turkey on the old embouchure and start working on a new one. And the problem with changing, so my old embouchure, for those who don't know, well, no one would know, of course. My old embouchure is very vertical motion. It just top down, just grip the mouthpiece, and that it can be biting, that can be all kinds of things. If you're doing double lip, that might be okay, but it's a ton of vertical motion, not a whole lot of forward momentum. So the muscles I were using weren't really strong. It was the jaw itself that was doing a ton of work. So plus adding the impacted wisdom tooth thing on top of that was just making a lot of stress on the jaw from several different angles, and that's probably what contributed to the dysfunction I have now. And what was I gonna say? Oh, you're talking about embouchure. So the embouchure that we changed it to now is more like an O shape, where you're bringing the corners in and forward to the horn. So it's less about the jaw. The jaw helps to support it, but it's not like only doing all of the action. So that is way more beneficial, especially for someone who has that dysfunction. It's not going to be causing extra pain to it, but it's not going to be relieving it either. It's not going to just go away now that I've changed the embouchure. But yeah, sorry, I'm veering off topic here. If you want to get me a little bit back on.
Oh, you're good. I wanted to ask about with just that whole process of not playing the instrument for a month and even longer, and that it's, I mean, for what we do as musicians, it becomes our identity, our instrument and playing, and so much with a term that's pretty common now, grinds culture, of that more is better. And I know both you and I have experienced that at, different schools where just practice more and more and you're going to be better off for it. But in this case for you, it definitely was a better option to like recover and to not play the horn. But just what was that process like, and how did that feel to kind of back off from it?
Mentally, it didn't feel good. I think that's normal because of what you talked about with the grind culture thing. Yeah, more is better. Everybody is pushing, and then, we have professors that are kind enough to say, don't do that.
Mm-hmm.
You should take breaks. You should do that. But all of us are kind of behind closed doors, going, nah. But we see that other guy practicing 8 hours a day. I gotta practice 9 so I can stay ahead of that guy. And it's a very toxic mentality to fall into, of course, and it will lead to injury like nine times out of 10. In some fashion, you will hurt yourself if you don't do that, or if you don't take breaks. So to not have my instrument out in general felt like I was severely going to fall behind. I felt like the muscles that I did gain in my face were going to go away, which they did. I felt that my musicianship was going to suffer. I felt like it was going to be hard to get back on the horn again, and it was just a lot of mental stress. Physically, it did good things for me, of course, because I wasn't forcing pain and I wasn't putting myself back into that position that I shouldn't be in for some time. But I was also training new muscles during that. So you talked about, me sending you pictures of things. I don't even remember what the contraption was anymore that I sent you. But I would do faces in the mirror. Like my lessons were take a mirror and I'm going to make faces in this thing several times. It's like doing weight training, but just with your
Right.
face. Just making the embouchure shape over and over again. You just flatten the chin, bring in a corner, go forward, and then hold that forever. And the moment that you do it the wrong way, you got to stop and do like 10 more reps. And it's like, it felt like weight training. And it looks easy now because I've done like for like 3 years how to learn it again, cold turkey. But in the moment, it was so hard. I didn't have enough muscles to like move the right pieces of my face. Like they were all kind of moving as one big like muscle, and I had to like learn how to separate all those different parts and stuff. So it was cool to see the progress when it was all done,
Mm-hmm.
but going through it was a very difficult mental experience that I would love to never ever go through again and never wish on anybody. It does make you feel like we talked about before, the depersonalization thing. It does make you feel like you are not, being yourself anymore.
Mm-hmm.
It's back to like doing technique stuff again, and that's probably where the brunt of my mental issues with it was coming from. But it worked out. It got there. It just takes a lot of reflection and a lot of hard work.
Yeah, I mean, and it's tied to your character, your musicianship, and that instrument, like whether clarinet, saxophone, piano, whatever we play. I think after reflection for certain periods like that, I have never gone through anything what you're describing specifically. but any similar type thing I can reflect on or see that others have dealt with is that periods of time away from the horn can lead to some hidden positives sometimes of just mentally being away from that. Did you kind of have any of those like this time period?
I think there was so much panic and anxiety in being in school still and doing it
Mm.
and starting a new place, especially being a grad student for the first time. You do have some ideas of like, I want to be perceived as a grad student, um, and that's a mentality I constantly tried to go against. And so it was harder for me. I didn't see a whole lot of positives at the time. Now looking back, I would assume that there has to be, like I at least got to relax my arms for a bit. I wasn't super tense with those because I was very close leaving CMU to getting tendonitis. Like that was a very focused issue I was working on with Dr. White at CMU, and I'm lucky it didn't go that far, and I haven't had issues with that since. I've learned to relieve it. I don't wear the neck strap anymore because I can actually physically support the horn. So like there were some positives in not having to hold the horn at all and play it, but yeah, it's like balancing the scales of like the pros and cons from the mental fatigue versus like the physical relief that was happening there. But then the physical pain was happening in other places, so it just became a very complex thing to sort through
Mm-hmm.
in the moment. But I'm glad I can still look back on it now and say that yes, it was really hard, but there are some good things. There's always going to be a good side to things like that. You just gotta look really hard to find it sometimes.
I'll say just from the outside, you've always been a fantastic pianist. But just
Thank you.
shout out to Guided Lime. That'll be in the description. But some of the music streams you've been doing this last year, they're just like really incredible, and that's definitely been something I've seen from the outside, and just kind of I don't know, your things can kind of go in like different directions, and you aren't any less of a clarinetist, and in fact you're more, and you're also even more of a pianist. And so, but and it's just kind of how life is sometimes, where it's not the exact destination that we expected, but like
Yeah,
different things come out of it. But for sure, people check out those music streams. Everything
I
Ethan's doing
appreciate
there
that.
is really great. So yeah.
Thank you. I do appreciate that. And yeah, I mean, when I came back when COVID started and I came back to finish the degree virtually, um, I didn't expect that was where I was going to go either. I had to find a hobby to force myself to not pull out the instrument too much and erase all of the progress I was making because I was very steadily going through the embouchure reformation. And then when I was going to do physical therapy and Alexander techniques and all these things to help relieve pressure in the jaw and manage it, um, I couldn't do that anymore. I was back home, completely different states away, and I didn't have access to those things. And plus, we were on lockdown, so it was very hard to get myself to not pick up the horn like for several hours a day and just try to push through it. And like, if I grind hard enough, my endurance will come back, and that's not the way to do it. So I'm glad I had piano. I'm glad I used that with the guided lime stuff to pursue something else for a little bit, make an interest out of that, and let my body try to heal itself in a more regular way, um, while still trying to find different tools for managing it. Physical therapy was very, very nice, and I miss it. It was very good at resetting me back to a not a perfect position, but a comfortable position for the start of the week. And then by the time that I would get to the next weekly appointment, I'd be where I am now, just a little bit of dull pain and stuff and frustration with playing. And we can reset and we'll do it again. We'll come. Back next week and do it again. So it was a helpful cycle to go through, but kind of was just like a reminder that, at least for now, it's not something that's going to go away. There are surgeries and stuff I could get to fix it, hopefully. But as things are now, managing it and refreshing it is about the only thing that I can do with it. And so having those tools taken away for COVID, that was my biggest frustration, probably out of anything that we've had.
One, you've talked to me a bit about the improvement of like endurance with playing with TMJ. and that how some it kind of feels like an improvement, like you can play longer, say 30 minutes, whatever arbitrary amount of time, but then maybe the next day it's like 10 minutes. But then it climbs up even a little more maybe the next day. And has that kind of been your experience with the gradual improvement over the last 2 years with it, or?
It's a little bit more random, but I mean, there is
Hmm.
still some of that back and forth nature where you have days where I gotta say me instead of you because I'm the one going through it. I have days where I can get really emotional while playing for good reasons. You know, I'll finish playing through a whole piece and I'll be like, oh my gosh, I can't believe I made it through that, you know, and you kind of break down into like happy tears. But then you have other days where, you know, you do a warm up and you wait for a minute and you play a beginning of a piece, you get 8 measures in, and your face just already feels like you've been playing for 3 hours. And then you have a bad breakdown of like, why is this not, you know, better by now? And it's not a linear recovery, I guess, if that's the best way of putting it. Um, and that can be super frustrating, you know. And I could be so much worse off too. I know that, you know, it can always be worse. um, where I could have tons of other injuries that would actually prevent me from playing at all. But those can be really demeaning and demoralizing, of course, when you just put the horn together and you've been playing it for 12 plus years and all of a sudden you can't play more than like 6 measures in a slow piece without falling apart. Um, that happens a lot less now. So there is a bit of a progression still. It's just not solely linear.
Hmm.
And I find that no matter how physical the problem, at least with what or had happened so far, the mental aspect of the things is always what's more difficult. You know, like take anything that you've been doing for years, and all of a sudden, if you take that away, or like you can't do it as easily as before, you're gonna immediately question in your mind, why can't I do this as easy as I usually do it? You know, and that's where that frustration comes from. It's a very simple thing, I think, to understand that aspect of it. Um, and I think it's going to be a long time till I see myself able to manage that thought process a little bit better instead of just being like, why can't I do this? And just right away understanding this is why you can't do it. And that's okay that you can't. And you're taking the steps. And you just kind of have to be all right with that, you know. Um, and the last thing I'll say, because I've been going for a bit, is that the grind culture thing, you know, not being able to do the grind culture when I stopped playing altogether and worked on embouchure, that was difficult. It's still a problem now, 2 to 3 years later, where I still can't contribute to the grind culture or anything like that because I physically can't play longer than people. And that can be frustrating because I will feel in the back of my mind like I can't improve as much as someone else who doesn't have this problem, which isn't true. It just means that my practicing has to be way more streamlined and really focused. It's way less full run throughs, way more things with the metronome pulled out, and really tackling things slowly. And it's better for me. It's helped me. I don't really want to say that TMJ dysfunction has helped me, but it has at least helped me to be a little bit more reflective on what I want to do with my practice time and you know, being able to reflect on that once it's over. And so there have been some positives that come out of it, but man, to say that I needed an injury to make that improve would not be the correct statement at all. Um, it's weird. It's a
Yeah, I
weird
mean,
time.
it's such a challenging process, and I don't think anyone would wish it upon anyone else.
No.
But I guess a large takeaway from everything you just said is that I really like the point you brought up about uh, the mental effect and physical effects. How TMJ is very much a physical affect for like as a player, but that physical effects can also cause mental ones, and those can be on like fluctuations like every day. You could physically be able to play the horn, but because of not being able to physically play days prior, like that could affect your mental at that point. And it's like
Hmm.
kind of circular sometimes where one's causing the other. Is that
Yeah. Oh
okay?
yeah. That's hit the nail on the head. The fun part is that you can't plan for it. You
Mm.
know, you think that you've got it figured out, especially with me where I've had this going for like 2.5 years now. Um, that's not a whole lot of time in the grand scheme of things. There are people who've been living with TMJ since they were children, and there are people who are in their 80s who might have picked it up in their 20s. I don't know. I think it becomes manageable to a point where you just don't mind it as much, depending on like normal daily life. I don't know how it's affected much with musicians because I haven't found a lot of people who are going through similar problems, And the only times that I've met anybody that has a similar problem as me, they've said the whole like, do you get a mouth guard thing? Do you grind your teeth at night? Do you do all this stuff? And that's about as far as it goes outside of, sorry, I wish we could help. You should go get surgery. Go pay thousands and thousands of dollars for surgery that you may not work. It may not even be successful. Who knows? Or they might strike the nerve that'll make half your face numb for the rest of your life, so you won't be able to play clarinet. Like, that's the thing that they'll tell you when they take the wisdom teeth out. There's a small chance that they may hit a nerve, and that if they touch that nerve or whatever, like, you won't have full control of your face.
I didn't know that was like a risk factor. Oh.
That's a big risk factor. And for most people, they don't mind. It's like you might have slight numbness in a part of your face for the rest of your life. It may come back, it may not, but there are cases of it. And so I was like getting the wisdom teeth out, knowing that the pain was so bad, but then I would see that where it's like, hey, you might not have full control of your facial muscles again. And it's like, oh, I don't know. Maybe I can deal with this pain for the rest of my life because I don't want to, stop playing. Luckily, that wasn't the issue as far as I could tell. But yeah, face stuff can be really complicated when you go near the jaw and the gum line and stuff. And yeah, surgery can be a very odd thing. So I don't even know if that's something I want on the table, because I have been able to manage this, I think, fairly well, better than I would have expected myself to be able to. But I don't feel like it's something that's going to go back to like normal. I'm pretty sure it's going to be like this for the remainder of my life, and I just have to find new ways to strengthen it and to mentally strengthen myself as to not get so bogged down when there are step backs, every so often, or where I need a rest day and I can't pull out the horn.
Yeah, I think it's such a challenge to go through this, and I have so much respect for you as a person and a musician to see you go through this struggle, and it's not something everyone could. So really applaud you for it. And
thank you.
I guess I know this maybe is kind of putting you on the spot, but if that's a great start to anything. But with TMJ, or maybe just any physical, if there's other musicians out there that are listening to this that have TMJ, or maybe going through a physical recovery process, not being able to play their instrument for like a month or months or a period of time, what would be some advice or something that you would tell them, I guess, going through that period?
Man, yeah, it's a really hard thing to address to anyone, especially knowing that any injury is so individualized. You can only say so much, and you can only empathize with someone so much. The best thing that I would say is to be as patient as possible. Easy thing to say, really hard thing to do. And knowing that despite the grind culture, despite anything like that, there really isn't a deadline for you recovering, and figuring it all out. And you kind of have to be okay with taking whatever path you're on, just like you would for a career path or anything else. You have to take the path and reflect on it when you need to and all, but don't drive yourself crazy wanting to get back to a sense of normalcy so much, because it's going to take a bit. 9 times out of 10, the injury is going to take a while to heal, or it may not even heal fully one day. And it's hard to give advice on something like that, because that you feel like you're going to come out a different person, than you were before because of that physical problem. But, surround yourself with people that care about you and can help to put you up through that and remind you of the steps forward when you are suffering from steps backwards. That's probably the best thing I could say, I keep saying.
Thank you all so much for listening. I really appreciate it. Ethan and my first discussion is linked on screen, as well as Ethan's live stream in the description. Please check out their live stream if you have a chance. Lots of video games and music streams, and just a great time. Again, thanks for listening, everyone, and take care.